Good day to you wherever you are in the world. My name is Dr. Dwight Turner. I am in the United Kingdom. I work at the University of Brighton, where I am the course leader in humanistic psychotherapy currently. I'm also a psychotherapist in private practice, working with individuals normally over the age of 18. I'm not as such a family therapist, but I was invited to write a paper for the journal. I'll read the title of the paper. It's called Empire to Emancipation, Potential Decolonial Pathways in Family Therapy. Now, I want to spend a couple of minutes just talking a bit about the concept of this paper and why I was actually drawn to actually write it for yourselves. The idea being that this, basically, all forms of therapy, normally Western therapy, because they're all normally Western, they're all colonized in their ways of seeing the world around us. They're presented through a very white, Eurocentric, patriarchal lens, and family therapy is no different in this instance. This therefore means that when we talk about decolonization, which is more than just putting on more books on shelves and so on, but actually involves looking at the theories that we've got and considering where they've come from, who created them, and who they marginalize in those instances, then we start the long, painful process of decolonizing our work, where decolonization actually involves broadening out the range of families that we can actually work with. Now, what I've done with this paper is presented it through the lens of a client of mine called Jaspreet. Part of her presenting issue was that she was living within a family whereby there was abuse. Now, what I mean by that is, for Jaspreet, who was South Asian in origin, she was raised within a community, a family community. And she often used to see her parents, her mother in particular, who would take on the father and bully him incessantly. This is something that she was left with, and something which brought her to therapy myself. Now, the reason why I've actually presented this through a family therapy lens is that traditional sort of theories perhaps wouldn't be able to understand the more culturally nuanced part of the work that I was doing with Jaspreet. And only by understanding her cultural and therefore family community difference was I then able to actually explore what was going on for her and what it meant for her to be raised in such a difficult environment. So this paper, which isn't that long in many ways, and I encourage you to read it, explores how actually when we start to broaden out and question the ways of working that we've been given, then we start to actually understand how we might work with a wider range of clients and of families. Thank you for taking the time to watch this video.